My friends, I want to share something very powerful with you. Your body is constantly working behind the scenes. Even when you're resting at night, your body is in repair mode. It rebuilds tissues, restores energy, and balances your hormones. If you're not giving your body the right nutrients during this critical time, for years, clinical trials have shown its power. A double-blind, placebo-controlled study on adults over 60 with mild insomnia found that after just 8 weeks of magnesium supplementation, sleep efficiency improved significantly, deep sleep duration increased, and reports of muscle cramps and morning stiffness dropped dramatically. And it's not just magnesium. A 2017 randomized controlled trial found that adults aged 50 to 80 with low vitamin D levels saw a 30% improvement in sleep quality after just 12 weeks of supplementation. But don't worry, in today's video, Health and Wellness will guide you on how to use these nightly vitamins as a simple nightly routine that can not only rebuild muscle, but also improve overall well-being. And don't skip the beginning of this video, because I'll share the scientific reason why a simple mineral like magnesium can actually become a man's secret ally in maintaining vitality after 60. Before we dive in, may I get to know you? Where are you watching this video from? Please leave your answer in the comments. I'd be happy to know who I'm sharing this journey with today. If this is your first time visiting the channel, don't forget to hit subscribe and turn on the notification bell so you won't miss any upcoming videos on men's health. Now that we've established the science behind why your nighttime recovery matters, let us dive deep into the specific nutrients that can transform your sleep into a powerful muscle rebuilding experience. We work closely with healthcare professionals who consistently see remarkable improvements when seniors use these evidence-based approaches alongside their medical care. Our research team has collaborated with leading geriatric specialists and sleep medicine experts to understand exactly which nutrients support your body's natural nighttime repair processes. What we've discovered may surprise you. It's not just about taking vitamins. It's about understanding how your body's wisdom works after 60 and supporting it at precisely the right moments. Let us share Robert's story, one that perfectly illustrates what we see regularly in our community. Robert is 68, a retired electrician who spent 35 years working with his hands. After retirement, he noticed his morning stiffness was getting worse, and despite sleeping 7 hours each night, he'd wake up feeling like he hadn't rested at all. Robert came to us, already working well with his doctor for his mild arthritis. What he wanted was to wake up feeling refreshed and maintain the strength he needed for his woodworking hobby. We helped him understand how to discuss targeted nighttime nutrition with his medical team and integrate it safely into his routine. Within 6 weeks, Robert noticed he was waking up with less stiffness in his hands and shoulders. His doctor was pleased with the progress and how he took an active role in his wellness. Today, Robert continues both his medical care and this natural approach, feeling more energetic during the day and sleeping more soundly at night. Here's what happens when you provide your body with the right nutrients before sleep. Your body works like a well-maintained repair shop that operates most efficiently during the quiet hours of the night. As we age, this repair process naturally slows down, which is completely normal. However, targeted nutrition can help support this natural process, helping you feel more refreshed and maintaining better muscle function. The wonderful thing is, this works with your body's own wisdom, not against it. Research from respected medical institutions supports this approach. Studies with people over 60 show that strategic nighttime nutrition can help improve sleep quality and support muscle maintenance. In our experience working with healthcare professionals, when people use this with their doctor's knowledge, they often report feeling more rested and experiencing less morning stiffness. Let's explore the 4 powerful allies that can transform your nighttime hours into a period of true restoration. The first ally, magnesium, your natural relaxation. Mineral magnesium works like the master switch that helps your muscles shift from work mode to recovery mode. Think of your muscles as having 2 settings. Calcium tells them to contract and work. while magnesium tells them to relax and repair. Most people get plenty of calcium from food, but magnesium often runs low, especially as we age. Here's the fascinating part. Magnesium doesn't just help your muscles relax physically, it also helps calm your nervous system by supporting the production of GABA, a natural compound that helps your brain transition into sleep mode. This dual action makes magnesium particularly valuable for seniors who want both better sleep and improved muscle recovery. Clinical evidence strongly supports magnesium's role in senior wellness. Research, published in the Journal of Research in Medical Sciences, followed adults over 60 with mild sleep difficulties. After 8 weeks of magnesium supplementation, participants experienced a 14% improvement in sleep efficiency and fell asleep an average of 12 minutes faster than those taking a placebo. Even more encouraging, reports of muscle cramps and morning stiffness dropped dramatically. Healthcare professionals we collaborate with consistently observe these same benefits. Dr. Margaret Chen, a geriatrician we work with in Pennsylvania, notes that when her patients discuss magnesium supplementation with her, those who use it appropriately often report sleeping more soundly and waking with less muscle tension. What makes magnesium particularly interesting is how it supports your body's natural repair processes. During deep sleep phases, your muscles undergo microscopic repairs and rebuilding. Magnesium helps ensure these processes run smoothly. By maintaining proper muscle cell function and supporting protein synthesis, the process your body uses to build and maintain muscle tissue. For practical implementation, we always encourage our community to discuss magnesium supplementation with their healthcare providers. Most doctors appreciate when you come prepared with research-based questions about supporting your body's natural processes. Forms like magnesium glycinate or citrate are often better absorbed than magnesium oxide, but your healthcare team can help determine what's most appropriate for your specific situation. One important consideration: magnesium can interact with certain medications, particularly those for heart conditions or blood pressure. This is exactly why working with your medical team gives the best results, as they understand your complete health picture and can guide you safely. The second Ollie. Vitamin D, your nighttime repair coordinator. Vitamin D functions like the supervisor of your body's repair crew, making sure calcium and magnesium get used in exactly the right places at the right times. While many people think of vitamin D only for bone health, emerging research shows its crucial role in muscle function and sleep quality, especially for seniors. Here's how vitamin D supports your nighttime recovery. It helps regulate the proteins responsible for muscle contraction and relaxation, ensures calcium gets properly utilized for muscle function rather than causing stiffness, and supports the production of key hormones that control your sleep-wake cycle. The research evidence is particularly compelling for our age group. A randomized controlled trial published in Nutrients followed adults aged 50 to 80 with initially low vitamin D levels. After 12 weeks of vitamin D3 supplementation, participants saw a 30% improvement in sleep quality scores and gained an average of 45 minutes of total sleep time. These improvements directly correlated with rising vitamin D blood levels. Leading health experts confirm that vitamin D deficiency becomes increasingly common after age 60, partly due to changes in skin synthesis and dietary absorption. Medical research indicates that this deficiency can contribute to both sleep difficulties and muscle weakness, two issues that often go hand in hand in seniors. Margaret, a 71-year-old former nurse we work with, experienced this connection firsthand. She had been struggling with restless nights and noticed her morning walks were becoming more difficult due to leg weakness. After discussing vitamin D testing with her physician and beginning appropriate supplementation, she noticed improvements in both areas within 3 months. What's particularly interesting about vitamin D is its timing flexibility. Unlike some nutrients that have strict timing requirements, vitamin D can be taken in smaller amounts during the evening without disrupting sleep patterns. In fact, Some research suggests that modest evening doses may actually support better sleep quality by helping regulate circadian rhythms. The key insight from our collaboration with healthcare professionals is that vitamin D works best as part of a comprehensive approach. It supports your body's ability to use other minerals effectively, particularly magnesium and calcium, creating a synergistic effect that enhances overall muscle function and recovery. Your healthcare provider can determine your current vitamin D status through a simple blood test and help establish the right supplementation approach for your needs. This is particularly important because vitamin D requirements can vary significantly based on factors like geographic location, sun exposure, skin tone, and existing health conditions. The third ally, vitamin C, your tissue repair specialist. Vitamin C serves dual roles in your nighttime recovery. It's both the raw material your body needs to build strong connective tissues and the cleanup crew that removes inflammatory substances that can interfere with rest and recovery. Think of vitamin C as essential building blocks for your body's repair projects. During sleep, your body produces collagen, the protein that acts like scaffolding for your muscles, tendons, and joints. Vitamin C is absolutely essential for this collagen production. Without adequate vitamin C, your body simply cannot maintain and repair these crucial structures effectively. The second role of vitamin C involves its powerful antioxidant properties. During daily activities, your muscles naturally produce oxidative stress. Think of it as the cellular equivalent of exhaust from a car engine. While some of this stress actually signals your body to adapt and grow stronger, excessive oxidative stress can interfere with recovery and contribute to morning stiffness and discomfort. Scientific studies demonstrate vitamin C's effectiveness for our age group. Research published in the American Journal of Clinical Nutrition followed adults over 55 who supplemented with 1,000 milligrams of vitamin C daily. After 8 weeks, participants experienced a 25% reduction in muscle soreness following physical activity, along with blood markers indicating improved collagen synthesis. Healthcare professionals we collaborate with frequently observe these benefits in practice. Dr. James Rivera, a sports medicine physician who works extensively with active seniors, reports that patients who maintain adequate vitamin C levels often experience faster recovery from exercise and less joint stiffness overall. What makes vitamin C particularly suitable for evening use is its water-soluble nature. Unlike fat-soluble vitamins that your body stores, vitamin C gets used throughout the night, and any excess is naturally eliminated. This means taking vitamin C before bed provides your repair processes with a steady supply of this crucial nutrient during peak recovery hours. Charles, a 66-year-old grandfather of 4, discovered this benefit after starting a gentle evening exercise routine. Initially, he experienced significant muscle soreness that interfered with his daily activities. After discussing vitamin C supplementation with his healthcare team and incorporating it into his evening routine, he noticed markedly less post-exercise discomfort and better overall recovery. The timing aspect is particularly important for vitamin C. Since your body cannot store significant amounts, taking it in the evening ensures availability during the crucial overnight repair window. This is when your growth hormone levels naturally peak, stimulating tissue repair and muscle maintenance processes that depend on adequate vitamin C availability. Clinical evidence suggests that vitamin C also supports immune function during sleep, when your body conducts much of its immune system maintenance. This dual benefit, supporting both muscle recovery and immune function, makes vitamin C particularly valuable for seniors who want to maintain their vitality and resilience. The fourth ally, vitamin B6, your protein utilization expert. Vitamin B6 functions like the skilled craftsman who takes raw protein materials and transforms them into strong, functional muscle tissue. If protein is the building blocks, Vitamin B6 is the expert who knows exactly how to use those blocks most effectively. Here's how vitamin B6 supports your nighttime recovery. It enables your body to properly process and utilize the protein from your evening meal, supports the production of neurotransmitters that regulate sleep cycles, and facilitates the conversion of stored nutrients into energy for repair processes. The sleep connection is particularly fascinating. Vitamin B6 plays a crucial role in producing both serotonin and melatonin, the hormones that help regulate your natural sleep-wake cycle. Serotonin helps you feel calm and relaxed as evening approaches, while melatonin signals your body that it's time for deep, restorative sleep. Research published in Neuropsychopharmacology provides compelling evidence for B6's effectiveness in seniors. The study followed adults aged 50 to 75 with mild sleep disruptions who took 100 milligrams of vitamin B6 each evening. After just 4 weeks, participants experienced a 22% reduction in nighttime awakenings, with morning urine tests showing increased levels of melatonin and serotonin metabolites. Our community member Frank, a 72-year-old retired factory supervisor, experienced these benefits directly. He had been waking up multiple times each night and felt exhausted during the day despite spending 8 hours in bed. After working with his doctor to incorporate B6 into his evening routine, Frank began sleeping more soundly and waking up feeling genuinely refreshed. The protein utilization aspect of B6 is equally important for muscle maintenance after 60. As we age, our bodies become less efficient at using dietary protein for muscle synthesis. Vitamin B6 helps bridge this gap by facilitating the complex biochemical processes that convert protein into functional muscle tissue. Dr. Susan Martinez, a geriatric nutrition specialist we collaborate with, explains that many seniors consume adequate protein but may not be utilizing it optimally due to B6 deficiency. When her patients address this through appropriate supplementation, they often notice improvements in both muscle strength and sleep quality. What makes B6 particularly interesting is its role in homocysteine metabolism. High homocysteine levels, common in seniors, can interfere with both cardiovascular health and sleep quality. Adequate B6 helps keep homocysteine levels in healthy ranges, supporting both better sleep and overall cardiovascular wellness. The timing of B6 supplementation matters significantly. Taking it in the evening provides your body with the resources it needs during peak protein synthesis hours, which occur primarily during deep sleep phases. This strategic timing maximizes the muscle building and maintenance benefits of your nighttime recovery period. Clinical evidence suggests that B6 works synergistically with the other nutrients we've discussed. It helps your body utilize the muscle-relaxing benefits of magnesium more effectively, supports the tissue-building processes that depend on vitamin C, and works with vitamin D to maintain proper muscle function. Now that we understand the 4 allies that support nighttime recovery, we must also discuss 2 substances that can actually interfere with these beneficial processes. Understanding what to avoid is just as important as knowing what to include. The first disruptor, vitamin 12 energy at the wrong time. Vitamin 12 is absolutely essential for health and energy, but timing matters enormously. Think of B12 as nature's wake-up signal for your cellular energy system. It's fantastic for morning vitality, but can be counterproductive when you're trying to transition into rest and recovery mode. Here's what happens when you take B12 in the evening. It stimulates cellular energy production processes that should be winding down, can interfere with your natural melatonin production, and may increase mental alertness when you need your mind to quiet down for sleep. Research published in Sleep Medicine examined this timing effect specifically. The study compared seniors who took B12 supplements in the morning versus the evening. Those taking B12 in the evening experienced increased nighttime awakenings and lost an average of 38 minutes of total sleep time compared to morning users. Healthcare professionals consistently recommend morning B12 supplementation for this reason. Dr. Patricia Wong, a sleep medicine specialist we work with, notes that patients who switch their B12 from evening to morning often report immediate improvements in sleep onset and quality. The key insight is that B12 remains incredibly valuable for senior health, just not at bedtime. Morning B12 supplementation can enhance daytime energy, support cognitive function, and contribute to overall vitality without interfering with nighttime recovery processes. The second disruptor, high-dose vitamin E, antioxidant overload. Vitamin E presents a more subtle but equally important timing consideration. While vitamin E is crucial for overall health, taking high doses immediately before sleep can interfere with the natural oxidative signaling that initiates muscle repair processes. Here's the paradox. Your body needs some oxidative stress signals from daily activity to trigger adaptive responses and repair processes. Taking large amounts of antioxidants right before sleep can essentially turn off these beneficial signals before your body has a chance to respond appropriately. Think of it like dampening a small, beneficial fire before it can do its job of signaling the need for repairs. The oxidative stress from daily activity serves as a communication system, telling your body where repairs are needed. Excessive antioxidants at the wrong time can interfere with this natural communication. The solution isn't to avoid vitamin E entirely, but rather to time it appropriately. Taking vitamin E earlier in the day, particularly with meals, provides antioxidant protection when you need it most, during active hours, when oxidative stress is highest, while allowing natural repair signaling to occur during sleep. Dr. Michael Thompson, an integrative medicine physician who specializes in senior wellness, explains that the timing of antioxidant supplementation can significantly impact their effectiveness. When his patients adjust their vitamin E timing to earlier in the day, they often report better sleep quality and more effective recovery from physical activity. We'd love to hear about your experience with nighttime nutrition. Have you found approaches that work well alongside your medical care? Share your story in the comments. Our community learns from each other, and your experiences help guide our collaboration with medical professionals. Now, let's discuss how to implement this knowledge safely and effectively. The most common question we receive is whether all 4 beneficial nutrients can be taken together. The answer is generally yes, with proper medical guidance. Here's the practical approach we recommend. Start by discussing this information with your healthcare provider. Bring a list of the 4 allies we've discussed: magnesium, vitamin D, vitamin C, and vitamin B6, along with any questions about how they might interact with your current medications or health conditions. Most healthcare professionals appreciate when patients come prepared with research-based questions about supporting their body's natural processes. Your doctor understands your complete medical picture and can provide personalized guidance about appropriate dosages, timing, and potential interactions. The golden rule for beginning any new supplementation routine is to start gradually. Rather than introducing all 4 nutrients simultaneously, consider adding one at a time over several weeks. This approach allows you to observe how your body responds to each addition and makes it easier to identify which nutrients provide the most benefit for your individual needs. Quality matters significantly when choosing supplements. We encourage our community to select products from reputable manufacturers that follow good manufacturing practices and provide third-party testing results. Your healthcare provider or pharmacist can help you identify reliable brands and appropriate formulations. Linda, a 69-year-old retired teacher, took exactly this approach. After learning about nighttime nutrition, she discussed the information with her primary care physician. Together, they developed a plan to introduce magnesium first, followed by vitamin D after checking her blood levels. Over 3 months, Linda gradually added vitamin C and B6 to her routine. Today, she reports sleeping more soundly and feeling more energetic during her daily walks. Individual responses to supplementation can vary significantly. Some people notice improvements within days, while others may require several weeks to experience benefits. Both patterns are completely normal, and reflect the natural variation in how our bodies respond to nutritional support. Certain health conditions require special consideration when implementing nighttime nutrition strategies. For example, people with kidney disease need careful monitoring when using magnesium supplements, as impaired kidney function can affect magnesium elimination. Similarly, those taking blood-thinning medications should discuss vitamin C supplementation with their healthcare provider, as high doses may affect medication effectiveness. Heart conditions also warrant careful consideration. While magnesium often supports cardiovascular health, it can interact with certain heart medications. Vitamin D supplementation may affect calcium levels, which can influence heart rhythm medications. These interactions aren't necessarily prohibitive, but they require professional medical oversight to manage safely. The timing of your evening routine can also impact effectiveness. Most people achieve the best results by taking nighttime nutrients approximately 1 to 2 hours before their intended bedtime. This timing allows for optimal absorption while avoiding any potential stomach discomfort that might interfere with sleep onset. Creating a consistent routine enhances the benefits of nighttime nutrition. Your body responds well to regularity, and establishing a predictable evening routine signals your system to prepare for rest and recovery. This might include taking your supplements at the same time each evening, followed by other relaxing activities that support good sleep hygiene. Environmental factors can also influence how effectively your body utilizes these nutrients. Ensuring your bedroom is cool, dark, and quiet creates optimal conditions for the repair processes that nighttime nutrition supports. Some people find that gentle stretching or relaxation exercises after taking their evening supplements help transition their body into recovery mode. What questions would you ask your healthcare provider about adding strategic nighttime nutrition to your routine? Comment below. Your questions help us create better content for our community and guide our collaboration with medical professionals. Hydration plays a crucial role in nutrient absorption and utilization. Taking your evening supplements with adequate water helps ensure proper absorption, but be mindful of timing to avoid sleep disruptions from bathroom visits. Most people find that taking supplements with a small amount of water 1 to 2 hours before bed provides optimal absorption without interfering with sleep continuity. Diet interactions deserve consideration as well. Some nutrients are better absorbed with food, while others work best on an empty stomach. Magnesium, for example, may be better tolerated with a small snack to prevent stomach upset. Vitamin D is fat-soluble, so taking it with a source of healthy fats can enhance absorption. Your healthcare provider can help you optimize these details based on your specific situation and preferences. Storage and handling of supplements affects their potency and safety. Most supplements should be stored in cool, dry places, away from direct sunlight. Check expiration dates regularly and discard any supplements that have changed color, odor, or texture. Proper storage ensures you're getting the full benefit of your investment in nutritional support. Monitoring your response to nighttime nutrition helps you and your healthcare provider assess effectiveness and make any necessary adjustments. Keep a simple sleep diary, noting factors like how quickly you fall asleep, number of nighttime awakenings, morning energy levels, and any changes in muscle stiffness or comfort. This information becomes valuable data for optimizing your approach. Regular follow-up with your healthcare provider ensures your nighttime nutrition strategy continues to serve your evolving needs. As we age, our nutritional requirements and medication regimens may change, requiring adjustments to supplementation approaches. Annual blood tests can help monitor nutrient levels and guide any modifications to your routine. The cost-effectiveness of quality supplementation often surprises people. When you consider the potential benefits: better sleep, improved muscle function, enhanced energy levels, and greater overall comfort, the investment in appropriate nutritional support typically provides excellent value. Many people find that improved sleep quality alone makes the investment worthwhile. Travel considerations become important for maintaining consistency in your routine. Bringing a week's supply of supplements in clearly labeled containers helps maintain your routine while away from home. Check with airlines about any restrictions on supplement transportation. And consider bringing a letter from your healthcare provider if you're traveling internationally with prescription medications. Seasonal variations in sunlight exposure can affect your vitamin D requirements, particularly for those living in northern climates. Your healthcare provider may recommend adjusting vitamin D supplementation during winter months when natural synthesis decreases. This personalized approach ensures optimal support throughout the year. Drug interactions remain one of the most important considerations when implementing nighttime nutrition. Even natural supplements can interact with prescription and over-the-counter medications. For example, magnesium can affect the absorption of certain antibiotics, while vitamin C in large doses may reduce the effectiveness of some chemotherapy drugs. Always maintain an updated list of all supplements and medications to share with every healthcare provider you see. Emergency situations require special planning when you rely on regular supplementation. Consider keeping a small emergency supply of essential supplements in your car or workplace, and ensure family members or caregivers know about your routine in case they need to assist with medication management during illness or hospitalization. The psychological benefits of taking control of your nighttime recovery shouldn't be underestimated. Many seniors report feeling more empowered and optimistic about their health when they actively participate in supporting their body's natural processes. This sense of agency often contributes to overall well-being, beyond the direct physiological benefits of the supplements themselves. Technology can help you maintain consistency in your routine. Smartphone apps for medication reminders, pill organizers with daily compartments, and even smart pill bottles that send notifications can help ensure you don't miss doses. Find the system that works best for your lifestyle and preferences. Family involvement often enhances success with new health routines. Sharing your goals and approach with family members provides social support and accountability. Some couples find it helpful to implement evening wellness routines together, making the experience more enjoyable and sustainable. Community resources in your area might offer additional support for senior wellness initiatives. Many senior centers, libraries, and community colleges offer classes on nutrition, sleep hygiene, and healthy aging. These resources can complement your individual efforts and provide ongoing education and social support. The relationship between sleep quality and immune function becomes increasingly important as we age. The nutrients we've discussed support both better sleep and immune system function, creating synergistic benefits that extend beyond muscle recovery. This connection explains why many people who improve their nighttime nutrition routine also notice fewer minor illnesses and faster recovery from infections. Stress management techniques can enhance the effectiveness of your nighttime nutrition routine. Chronic stress interferes with nutrient absorption and utilization, potentially reducing the benefits of even the best supplementation program. Consider incorporating gentle stress reduction practices like deep breathing, meditation, or relaxing music into your evening routine. Weather patterns and seasonal changes can affect both sleep quality and nutritional needs. Some people find their supplement requirements vary with the seasons, particularly for vitamin D during darker months. Staying attuned to these patterns and discussing them with your healthcare provider helps maintain optimal support year-round. The importance of realistic expectations cannot be overstated. While nighttime nutrition can provide significant benefits for many people, it's not a magic solution for all sleep or muscle-related concerns. Serious sleep disorders, significant muscle weakness, or other health concerns require comprehensive medical evaluation and treatment. Supplements work best as part of a holistic approach to wellness that includes proper medical care, appropriate exercise, good sleep hygiene, and healthy lifestyle choices. If this evidence-based approach resonates with you, Please subscribe to Health and Wellness for more practical wellness education that honors your relationship with your healthcare provider. Share this with someone who values both natural wellness and medical expertise. The journey toward better nighttime recovery and muscle maintenance is highly individual, but the science provides us with valuable guidance. The 4 allies we've discussed: magnesium for muscle relaxation and nervous system support, vitamin D for repair coordination and sleep regulation, vitamin C for tissue building and antioxidant protection, and vitamin B6 for protein utilization and neurotransmitter production work together to support your body's natural nighttime recovery processes. Equally important is understanding what to avoid: vitamin B12's energizing effects that belong in the morning, and high-dose vitamin E that can interfere with beneficial repair signals. This knowledge helps you make informed choices about timing and dosages that support rather than hinder your recovery goals. Remember that every person's journey is unique, and what works best for you may require some experimentation under medical guidance. The key principles remain constant. Work with your healthcare team, start gradually, choose quality products, maintain consistency, and monitor your response. Your body has remarkable healing and maintenance capabilities at any age, and strategic nighttime nutrition can help support these natural processes effectively. The investment in your nighttime recovery pays dividends in daytime energy, comfort, and overall quality of life. By understanding how to work with your body's natural rhythms and repair processes, you're taking an active role in maintaining your vitality and independence for years to come.